Welcome to the Deep Dive, your shortcut to being genuinely well-informed, packed with surprising insights and just enough humor to keep you hooked. Today, we're diving into something really foundational, something that underpins pretty much every medical decision made about your health: clinical guideline.
hmm They're everywhere.
Exactly. Think about it: how your kid's asthma is managed, treatment plans for depression, heart disease, even cancer. These guidelines shape it all. They're meant to improve care, guide policy, basically tell doctors and nurses what the best approach is.
That's the idea, yeah. Standardized best practice based on evidence.
But here's the question, the one that keeps us digging. If they're so critical, how do we know they're actually any good? I mean, what if they give conflicting advice? Or maybe worse, what if they aren't even based on the best evidence?
Right. That's a huge concern.
Our health depends on these things. So the
Yeah.
quality, well, it's got to be paramount. Okay, let's unpack this.
Well, let's do it. Our mission today is really to pull back the curtain on a groundbreaking methodology. We're talking about a specific tool, a critical appraisal instrument developed back in the late 90s by researchers like Cluzeau and others.
Okay.
And this isn't just about, what a guideline says. It's about giving you the tools to figure out how trustworthy those recommendations actually are. It's about looking at the quality of the guideline itself, which is, a vital step.
Yeah, absolutely vital. Because the landscape out there, it can feel a bit like the Wild West, can't it?
It really can.
The goal is great, bring research into practice, but our sources, they point to this growing problem. Just so many guidelines, often saying different things. Imagine being a doctor or, frankly, a patient trying to make sense of that. It must cause a lot of confusion.
It does, and it undermines trust, ultimately.
So why does this happen? Why the variation?
Well, it's complex. Our sources suggest a few key reasons. Sometimes it's just different people read the same research and come away with different conclusions.
Okay, interpretation differences make sense.
Yeah. Or they might value outcomes differently. Is the main goal clinical improvement, or are economic costs weighing too heavily? That can shift things.
Ah, the cost factor.
Right. And then there's the big one: potential biases, conflicts of interest during development. Who funded it? Who was on the panel?
That can subtly nudge recommendations, I imagine.
Or not so subtly. And it leaves everyone wondering, which guideline is really the one to trust.
Which is exactly why this is so problematic for you listening.
Precisely. If you don't have a reliable way to judge the quality, how can anyone, clinician or patient, make informed choices? Often, the information you need to judge, like actual patient outcome data, just isn't there, especially for newer guidelines.
So you're stuck.
Kind of. And that's where this instrument comes in. It focuses on the process. How is the guideline made? It gives you a way to gauge quality, even without long-term outcome data.
Okay, so faced with this confusion, this need for quality control, what was the solution? You mentioned this initiative.
Right. So back in '93, the UK's NHS, the National Health Service, held a workshop specifically on this problem.
Okay.
And out of that came a research program to create this generic critical appraisal instrument. Generic meaning it could be used for any guideline.
Ah, versatile.
Exactly. Designed for anyone, GPs, specialists, managers, researchers, to systematically evaluate and compare guidelines. A common yardstick.
And the core purpose, what was it really trying to measure?
It boils down to assessing how systematically developed the guidelines were. Did the developers actively try to minimize bias?
Right.
Did they think about the practical stuff, like how it would actually be implemented in clinics and hospitals?
So it's like looking under the hood, checking the manufacturing process, not just the shiny exterior.
That's a great analogy. Exactly that. How was this thing built?
And how did they actually build the tool itself? Did it just appear?
No. Good question. They didn't start from scratch. They built on earlier work, particularly from the Institute of Medicine, the IOM, which had outlined desirable features for guidelines.
Okay, so building on existing ideas.
Yeah, they took that provisional IOM instrument, piloted it, got feedback from lots of different people involved in guidelines, and refined it down. The result was this list of 37 specific questions or items.
37 items. Okay.
And they grouped these into three main areas, three conceptual dimensions of quality. Each one is pretty crucial.
Okay, let's break those down. What are the three dimensions?
Yeah, the first and the biggest is rigor of development. It has 20 items. This is all about how the guideline was made. It asks things like, was the group who made it clearly identified? Did they declare funding sources? Any potential conflicts of interest?
Transparency, basically.
Exactly. And who is actually on the development panel? Did they have all the right people? Doctors, nurses, maybe even patient representatives?
A whole team.
Right. And how do they find the evidence? How do they evaluate it? Is there a clear link shown between the evidence they found and the final recommendations?
So showing their work.
Yes. And was it peer-reviewed by independent experts? Is there a plan to update it when new science comes out? It's all about that solid methodological foundation.
Got it. That sounds comprehensive. What's the second dimension?
The second is context and content. This has 12 items. It looks more at the guideline itself, its attributes. Is it reliable, applicable, clear, flexible?
Okay, so the usability, almost.
Sort of, yes.
Okay.
It asks, are the goals of the guideline clear? Who is it actually for which patients? Does it mention situations where the advice might not apply? Because medicine isn't one size fits all.
True. Exceptions are important.
Very. And critically, does it talk about the potential benefits, but also the harms or costs? Are the recommendations actually balanced based on that evidence?
So being upfront about the trade-offs.
Precisely. Is the content practical and honest?
Okay, rigor of development, context, and content. What's the third?
The third is application. It's the smallest, only 5 items, but as we'll see, it's where things often fell down. Yeah. This dimension asks, okay, you've made this guideline, now what? Does it suggest how to actually get it out there, disseminate it?
How to get it into doctors' hands.
Right. Does it suggest how to monitor if people are actually using it? And maybe most importantly, does it define measurable outcomes? Things we can track to see if the guideline is actually improving patient health.
So closing the loop, making sure it has an impact.
Exactly. It's about translating the document into real-world change.
And you said this was straightforward to use, despite all these detailed questions.
Surprisingly, yes. For each of those 7 items, the appraiser just answers yes, no, not sure, or not applicable.
Simple choices.
Yeah, but to make sure everyone interprets the questions the same way, they developed a detailed user manual. It explains each item, gives criteria for when to say yes.
Ah, so it standardizes the scoring, reduces subjectivity.
Exactly. It's designed to be a structured, systematic evaluation, not just someone's gut feeling. Highly reliable.
Okay, so they built this careful, structured tool. Then what? Did they test it?
Oh, absolutely. They put it through a really rigorous test. The study involved using this instrument on a big sample, 60 UK guidelines.
60? Wow.
Yep. 15 each for 4 major conditions. Asthma, breast cancer, depression, and coronary heart disease, all published in their early to mid-90s.
So a good cross-section of important health areas.
Definitely. And they didn't just get a couple of people to rate them, they recruited 120 experts as appraisers.
120? That's a lot.
It is. And a real mix national specialists for each disease. GPs, public health docs, hospital consultants, specialist nurses, even methodology researchers.
So bringing in different perspectives.
Exactly. And each single guideline was assessed independently by 6 different appraisers.
So 6 people looked at each one.
Yep. Which really adds weight to the findings and helps check if the instrument gives consistent results across different users. It was a thorough job.
Okay, so what did they find? Did the instrument work?
It did. The results were really quite telling. First off, reliability. The instrument showed what they called good internal consistency, meaning the questions within each dimension, like rigor or content, were genuinely measuring the same underlying concept, like items on a good quiz, all testing the same knowledge area.
Okay, cohesive.
Right. And maybe even more important, it showed excellent inter-rater agreement.
So different people scoring the same guideline got similar results.
Exactly. If you and I both used the tool on the same guideline, we'd likely come up with very similar scores. It wasn't just random, it was dependable, consistent.
That's crucial for a tool like this. What about validity? Did it measure what it was supposed to measure?
Good question. Yes, they found evidence of validity. The scores from the detailed 37 items correlated pretty well with the appraiser's overall kind of gut feeling assessment of the guideline's quality.
Ah, so it matched the expert's general sense, passed the sniff test.
You could say that, yeah. The detailed score reflected the overall impression, which suggests it was capturing actual quality differences.
Okay, so it works. Reliable, valid. Any surprising findings?
Yes. And here's where it gets really interesting and maybe a bit concerning. The instrument was clearly able to differentiate between national and local guidelines.
How so?
National guidelines, ones developed by major bodies, scored significantly higher across all 3 dimensions: rigor, content, application. Much higher than locally developed ones.
Wow. Significantly higher.
Statistically, yes, highly significant, which strongly suggests that the more systematic, resource-intensive national processes do tend to produce higher quality guidelines, at least based on this assessment method.
Okay, that makes intuitive sense, but it's good they could measure it.
It validates the instrument's sensitivity.
Right?
But then came the performance gaps.
Uh-oh.
Yeah. Most guidelines, when judged against these criteria, actually didn't do very well.
Really? How badly?
Over two-thirds of them scored less than 50% on the rigor of development dimension. The median score was just over 30%.
Only 30%, that's low. It means most weren't developed very rigorously.
According to this systematic assessment, yes. Huge gaps in documenting the methodology, considering bias, linking evidence clearly, like those napkin blueprints you mentioned.
Wow.
Yeah.
Okay. And what about the other dimensions?
Performance was poorest on that application dimension. Remember the one about implementation and measuring impact?
Yeah, the smallest
The
one.
median score there was only 24%.
Ouch. So most guidelines basically had weak or non-existent plans for how they'd actually be used, or if they even worked.
That seems to be the implication, like building that Ferrari you talked about, but forgetting the wheels or the keys. Lots of effort potentially going into documents that just sit there, or whose impact is never tracked.
That's a really crucial finding. A guideline isn't much good if it doesn't get used properly, or if we don't know if it helps.
Precisely.
Was there anything that correlated with better scores? Any sign of good practice?
Yes, one clear thing. Guidelines that came with background documentation papers explaining how they were developed scored significantly better on methodological rigor.
Ah, so transparency pays off. Being open about your process signals better quality.
It certainly seemed to in this study. It shows they did the homework and weren't afraid to show it.
Okay, so taking all this in, what does it mean for us, for the listener, whether they're a clinician or just someone interested in health?
Well, I think this instrument and the findings from using it represent a really essential first step.
Mm-hmm.
Helps ensure quality in healthcare. It moves us away from just saying, this guideline looks good or I don't like that one, to having a numerical description, a more objective way to compare them across those key dimensions.
Like going from a vague review to a detailed spec sheet. Gives you actual data.
Exactly.
So what are the practical impacts then? How does this change things on the ground?
For the people making guidelines, it gives them a clear roadmap, a checklist almost. It encourages them to be more systematic, more transparent, to reflect relevant research evidence more accurately.
Right, it sets a standard.
And for the people using guidelines, or maybe adapting them for their local hospital or clinic, it empowers them. They can use this kind of tool to critically evaluate different guidelines and choose which ones seem the most robust and applicable.
So they can make a more informed choice about which advice to follow.
Yes, it helps them ask the right questions. Is the evidence linkage clear? Did they consider implementation?
And you mentioned this isn't just theoretical, it's actually being used.
Oh, yeah. The NHS in the UK started using it pretty quickly to help decide which guidelines they should officially recommend across the whole system. That affects millions of patients.
Wow. Okay, so direct policy impact.
Definitely. And it's gone international. The methodology formed the basis for a common approach across Europe. There was a big EU research project involving 10 countries plus Canada, all working on adapting and using this kind of appraisal approach.
So its influence spread quite widely. That shows how needed it was.
Absolutely. In this era where we have huge online databases full of guidelines, you need some way to filter them. This adds that crucial quality dimension. It helps you navigate the information overload and find guidelines that are likely more trustworthy because they were built well.
It helps separate the wheat from the chaff, essentially, ensuring the advice you might get is built on a solid foundation.
That's the goal, making sure it's not just there, but it's sound.
Okay, so wrapping this up. It really feels like this methodology offers a powerful lens, a structured, reliable way to look at the very foundations of medical practice. It shifts us from just taking advice at face value to understanding how it was made, whether biases were addressed, if it meets high standards. It's empowering.
It really is. It helps us demand better quality in the information we rely on for our health.
Yeah.
But there's a final thought to maybe leave with you, the listener. While this instrument is brilliant for checking the process, the rigor, the clarity, it still makes an assumption. It assumes that following these good process steps automatically leads to guidelines that are truly valid and effective in the real world.
Okay. So a well-made guideline might not always translate to better health outcomes.
It's still an assumption that needs more testing. The researchers themselves pointed this out. The next big step is to test these appraisal tools against guidelines, where we do have evidence of their actual impact on patient health, their predictive validity.
So does following this well-rated guideline actually lead to better results for patients?
Exactly. That's the ultimate test. And it raises a bigger question for all of us. What other layers of trust, what other checks and balances do we need in our healthcare systems? How do we ensure the recommendations guiding our care are not just well-developed on paper, but truly sound and effective when it matters most for you?